Guide, where we talk about all things skin. As you know, in this series, we're going to be talking about the different skin types, their common concerns, and how to solve these. And in today's video, we're going to be looking at a skin type which a lot of us have, oily skin. It can be frustrating, but don't worry, we're going to break down everything we need to know in this video, what causes it, what issues it brings, and most importantly, how to manage it. So let's get started. Firstly, let's talk about what oily skin even looks like. If you've got oily skin, then you'll probably notice that your face gets shiny or greasy, especially in the T-zone, which is the forehead, nose, and chin. You might see larger pores or feel like your skin has a thicker texture. And then there's acne, which can consist of blackheads, whiteheads, and sometimes even cystic breakouts. However, there is one bonus, which is that oily skin tends to age slower because all the oil keeps your skin naturally moisturized, so fewer wrinkles. The main reason that all of these things happen is because of sebum overproduction, and sebum is the natural oil which your skin produces to keep it hydrated and protected. But when your sebaceous glands go into overdrive, it creates too much oil. And this oil can mix with dead cells, which clogs your pores, leading to blackheads, whiteheads, and breakouts. Now let's get into the good part, which is how to fix these issues. So first of all, for acne treatments and clogged pores, here's what works and how. Retinoids such as adapalene or tretinoin, these help to speed up cell turnover, which prevent dead skin cells from clogging your pores. They also smooth out texture and help fade acne scars over time. Benzoyl peroxide, which is great because it kills acne-causing bacteria and reduces inflammation, which is why it's a really good must-have for active pimples. Salicylic acid is really helpful for oily skin because it's oil soluble, which means it can penetrate deep into your pores, break down oil, and exfoliate from the inside out. And then we have azelaic acid, which fights bacteria, reduces redness, and fades acne scars by stopping the excess melanin production. For more stubborn acne, you might need to try prescription treatments such as oral antibiotics, which target inflammation and bacteria, spironolactone, which is a hormonal treatment that reduces oil by blocking androgen activity, isotretinoin or Accutane, which is a powerful medication that drastically reduces oil production, but it comes with serious side effects such as allergic reaction, change in vision, hearing loss or ringing in ears, increased pressure on the brain or severe headaches, liver injury, mood and behavioral changes, redness or blistering of the skin, stomach pain, dryness or irritation of the eyes, lips, mouth, or nose, joint pain, muscle pain, and nausea. So this should really be considered as a last resort. Next, let's look at how to fix blackheads. So blackheads need specific care because the blackheads, as we mentioned before, are when the oil and dead cells block a pore and the surface is exposed to air. So the gunk on top of your skin cells oxidizes and turns black. So to fix blackheads, you should use salicylic acid cleansers or toners, which work to unclog the pores by dissolving the oil and debris inside the pore. Glycolic acid, which exfoliates the skin's surface, which removes the dead cells that could cause clogged pores. Charcoal masks, which are great for drawing out impurities from within your pores, and even clay masks help to do the same thing. For more stubborn blackheads, dermatologists usually recommend chemical peels, extractions, or microdermabrasion, but all of these should be performed by a dermatologist. If you're worried to try these harsher or more chemical products, here are some natural remedies that you could try which might help. Tea tree oil is an antibacterial which penetrates the pores to reduce acne-causing bacteria. Aloe vera gel soothes irritation and hydrates without clogging pores. Apple cider vinegar has antibacterial properties which balances the skin's pH to reduce oil production, but it should be used diluted. Honey is a natural humectant which hydrates the skin, while its antibacterial properties help to fight acne and clogged pores. If these home remedies, products, and also dermatologist-provided medications aren't enough, some professional options include light therapy, which is blue light specifically, which kills acne-causing bacteria, and then red light, which reduces the inflammation, chemical peels, which go deeper to exfoliate and treat both acne and post-acne marks. And then there's steroid injections, and these are for more a painful deep cyst that just won't go away. Another important thing to keep in mind is that some of these treatments do come with some side effects, such as retinoids can make your skin dry and sensitive, especially in the beginning of use. So make sure that you use a hydrating moisturizer to help combat this dryness. The overuse of salicylic acid can dry out your skin way too much and cause a broken skin barrier and irritation, which could in turn lead to worse acne or clogged pores. Even the natural remedies, specifically apple cider vinegar, can cause burns if it's not diluted properly. And remember that you should always do a patch test and start slow when you're incorporating new products into your routine. And if you're in doubt, you should always contact a dermatologist to help create a routine that's helpful and beneficial to your issues. Now that we've discussed about all the issues oily skin usually faces and how to target those specific issues, you might be a little bit confused on how to structure your skincare routine. So I'm here to help. So we're going to start off with an acne fighting skincare routine. So in the morning, you want to use a salicylic acid cleanser or any cleanser with an exfoliant, or even benzoyl peroxide is fine, such as CeraVe Acne Foaming Cleanser, which has 4% of benzoyl peroxide. Then a toner, which could be apple cider vinegar or niacinamide, witch hazel, anything that's going to soothe your inflammation and minimize redness. Then you might want to use a spot treatment or benzoyl peroxide or azelaic acid to reduce redness and inflammation, such as the Paula's Choice Azelaic Acid Booster. Then for moisturizer, you should use a lightweight, non-comedogenic moisturizer, which is going to hydrate your skin without clogging your pores. And an example of this is a Neutrogena Hydra Boost Gel Cream. And then you should always use a sunscreen, especially if you're using a spot treatment such as benzoyl peroxide or any other spot treatment, to prevent your skin to become overly sensitive to the sun. Try to look for an oil-free and non-comedogenic sunscreen which has an SPF of 30 or higher. An example of this is the Ulta MD UV Clear SPF 46. And then your evening routine will look a little bit different. You should always start off with a double cleanse, which is either an oil cleanser or a cleansing balm, maybe even micellar water if that's what you want. Then you should go in with any toner to help balance out your skin's pH, again, apple cider vinegar or any other soothing toner. Then you're going to want to go in with either your exfoliant or your treatment. You should never use both on the same night, because this is going to cause your skin barrier to get very damaged and do the opposite of the results that you're expecting. If you're going to go in with an exfoliant, a chemical exfoliant such as salicylic acid or mandelic acid, which is really good because it's going to clear out your pores and reduce your dead skin buildup. An example of this is the Paula's Choice 2% BHA liquid exfoliant. And then if you're going to use a treatment, then you want to go in with a retinol or adapalene, which is a different gel, which is going to help speed up your cell turnover and prevent future breakouts. For both of these, you should always start off with 2 to 3 times a week and then build up from there if your skin's able to handle it. And then you're going to want to go in with a moisturizer. It could be a lightweight moisturizer or a slightly heavier moisturizer. It just depends on your preference, but ensure that they're both non-comedogenic. Now let's go into the routine for blackheads and clogged pores. So again, you're going to want to start with a salicylic acid cleanser, which is really just going to help break down the oil and everything and just get your skin clean. An example of this is the La Roche-Posay Effaclar Gel Cleanser. Then you should use a toner, which is a BHA toner, which will help loosen your blackheads and reduce your pore size. You could use a COSRX BHA Blackhead Power Liquid. Then you want to go in with a moisturizer, and you should choose a more lightweight moisturizer which hydrates without adding extra oil, which can be the Inkey List Omega Water Cream or the Cetaphil Oil-Free Moisturizer. You should always finish off with a sunscreen, which similarly to the acne routine, which is oil-free and non-comedogenic, and it should be above SPF 30. You can use either the same Ulta MD SPF or the Neutrogena Your Face Sunscreen, which is SPF 55. And then for your evening routine, you should again go in with a double cleanse, which is similarly an oil cleanser or a cleansing balm. This is just going to help break down the oil that's built up throughout the day and get your skin nice and clean. Then use the same salicylic acid cleanser from your morning routine, and then use an exfoliating toner or just your regular toner, because it should be an exfoliating toner to begin with, and it should be a gentle exfoliant, which is salicylic acid or glycolic acid, to clear out your clogged pores. An example of this is the ordinary glycolic acid. And then you should try to use a clay mask at least once a week, which helps to absorb excess oil and draw out all the impurities from your skin. So one that you could use is the Aztec Secret Indian Healing Clay. Mix it with water, apple cider vinegar, or yogurt and apply it onto your skin. It should not dry out completely, just for 5 or 10 minutes, and then wash it off. And then again, on a different night than the night that you use an exfoliant, you might want to use a retinoid, which is a different gel, or adapalene, to prevent your clogged pores. An example of this is a different gel, like as I said, and it has adapalene 0.1%. And then you want to go in with a similar lightweight hydrating moisturizer to maintain your skin's balance. A really good example of this is, as I mentioned, the Inkey List Omega Water Cream. And that's it for today's video. I know that oily skin, blackheads, and acne can be a pain to manage, but with the right tools, products, and patience, you can totally handle it. In the next upcoming video, we're going to be talking about the last skin type, which is combination skin. So stay tuned, and I'll see you next time.